So I think what I saw about spinal muscular atrophy therapies at the MDA conference holds some important lessons for what the future has in store for limb girdle muscular dystrophy. We are very fortunate to now have three FDA-approved therapies for spinal muscular atrophy. And I think that it's realistic to expect that certain subtypes of limb girdle muscular dystrophy may have multiple therapies approved in the future. That's a very exciting prospect, but based on the lessons we're learning about spinal muscular atrophy, it also provides us a lesson about some of the complexities that lie ahead. So for spinal muscular atrophy, now that there are three therapies approved and newborn screening that's occurring regularly, a lot of families are facing the question of my child was just diagnosed with this disease. I don't know how severe it is because my baby was just born. What therapy is best? Should we intervene now? And SMN2 copy numbers, as some of you know, is a helpful proxy for severity, but it's not precise. So that can provide some information, but and the clinical picture can provide some information, but sometimes it's a little bit difficult to make the best decision. So I think that holds lessons for limb girdle muscular dystrophy. We will likely have multiple therapies in the coming years for at least some of the subtypes for limb girdle muscular dystrophy. And newborn screening will only become more precise. I think the day is probably not too far off when we will be doing some form of exome or genome sequencing on newborns on a more standardized basis. And so we'll be picking up more of these diseases in the newborn period, sometimes long before patients are expected to be symptomatic. And then the question will arise, when do we treat? What treatments are best? Should we treat when the patient's still asymptomatic? And these are questions that have come up for spinal muscular atrophy, and they will be coming up for certain in limb girdle muscular dystrophy as new therapies become available.